Hey guys, welcome, man. We're so glad to have you join us for our mini review. We're going to do an NCLEX challenge this time. So what you need to know about this session is that we're going to cover 3 higher level NCLEX questions. We're going to talk very deeply about them. We're going to find the content and talk about that. We're going to talk about strategy that we could have used, and we're going to talk about how you effectively answer that question. Right and wrong answers, rationales, everything. All right, guys, so let's go ahead and jump in. And the first thing that we're going to cover here is let's just talk about the NCLEX first. Let's make sure we understand what our NCLEX is going to look like. With the NGN format, you have 5 hours max testing time. It may not take you 5 hours, but you've got 5 hours just in case you need it. You're going to see 85 questions as a minimum question count, 150 questions as a maximum question count, and your test can cut off at any point in between those two numbers. Now, not everybody's going to take the max test, but everyone will see at least 85 questions. All right, let's talk a little bit about Hurst Review because I want you guys to understand who we are and how we operate as a company. We are a company of nurses for nurses. Our founder's a nurse. Our entire curriculum team, all nurses. All of our faculty are nurses. But we've also got 1 or more nurses in every part of our team here at Hurst Review just to give you that nursing support that you need. So sales, marketing, social media, customer support, all of those teams have at least 1 nurse on those teams too, just to give you the support that we know that you need. All right, let's talk a little bit about data. Now, what you need to know first is that we love when people hop on social media and they are saying, what did you use to prep for the NCLEX? But we really like it when we get tagged in that post. And so 9 out of every 10 students that takes the Hurst Review turns around and tells somebody else about the Hurst Review. And we love that. Now, our pass rate used to be, and I love saying this too, it used to be 98%. And we used to just say 98 plus because we had a pass rate calculated for our RN students and we had a pass rate calculated for our PN students, and the lowest it was 98. It was higher than that for one group, so we just said 98 plus. But we've recalculated our pass rate, and so over the last few years we needed to make sure that we were keeping current, making sure that we recalculated that, and we are so excited to say that we can just drop the plus and we can say 99.8%. So our first time test taker pass rate is 99.8%. This just means that if it's a first time test taker's chance of taking the NCLEX and they use Hurst Review to prep, when they walk into the testing center, they've got a 99.8% chance of passing on their first attempt, and we love that. But we are not just the review for first-time test-taking students. We're the review for all students. So if you have already taken the NCLEX before, we are the review for you as well. And guys, 30 years, in fact, over 30 years. This is year number 37 for the Hurst Review team, and we've held a high pass rate for that entire length of time. And so we're so excited about being able to help you too. All right, let's talk a little bit about the NCLEX because there's some data that does not belong to us but comes from the NCSBN that we find really helpful. What the NCSBN says about the NCLEX is that if a candidate doesn't pass on their very first attempt, then their chances of passing have automatically declined. Now, why is that? It is not because they make the test harder for a repeat testing student. It is because their data shows that to have the best chance possible on the NCLEX, you need to attempt your NCLEX within 3 months of your graduation date. Well, when you have to repeat the test, you know you have to wait at least 45 days in between each attempt. So that's going to put you either close to or over that 3-month time frame that they recommend for everyone. Because a lot of people already wait on the front end. They're like, I'm going to study some more and then I'll go and take my NCLEX. Well, then if you don't pass, you've got that 45-day wait period. That's just putting you too close again or over that time frame that they recommend. Now, another thing that happens, students look at the NCLEX as an extension of nursing school. So whatever I did in nursing school, whatever test I took in nursing school were absolutely enough to prepare me for this test. But the problem with that thought process is that it's not an extension of nursing school. It's trying to see, can you break away from the thought process of nursing school and show us that you are no longer a student, but you are a brand new nurse. And so the goal and the focus doesn't have anything to do with nursing school or meeting requirements or anything like that. It is to protect the public from unsafe practitioners. And so this is a safety test in its entirety. And they want to know, as a new nurse and not a nursing student, what will you do? How will you perform care? How will you keep the client safe? Guys, because of that, you got to answer the questions differently. There was no test in nursing school that was like that. Those tests were to meet requirements and to make sure you understood. The NCLEX says, great, you did that. We no longer care about that. Show us something different. And this is the reason why sometimes students struggle so much on the NCLEX, is because they're treating it like nursing school, and it's not. So what we're going to do today is show you how that's different and the way that you respond. And now one of the ways that we teach students and prep them is every student that takes the Hurst Review receives the Hurst Review workbook. Now the workbook is very concise. It is not written like a textbook, first of all, and it is also in conversational language, but it doesn't have full sentences. It is bullet points, blanks, simple phrases, pictures, diagrams, charts, and graphs. And those blanks, we help you fill those in. So at the end of this, when you get your workbook fully filled in, it's your study guide for the NCLEX. All right, what we want to do now is let's go ahead and jump into these questions. And again, let me tell you the process. We're going to do 3, look at one at a time. We're going to put the first question up here on your screen, give you some time to think about it. And when you think you know what your answer or answers are, it just depends on the nature of the question, you're going to use your chat to let us know what you think there. After we get some answers, I'm going to come back in, I'm going to go over this with you, but we're going to go over it deeply, discussing right and wrong answers, rationales, content, and any strategy that you could have used. So that way, you can use those things that we talk about on a future question. All right, so look at this question, let me know what you think, and I'll be back with you in just a little bit. All right, friends, if you need a little bit more time, you've got it. But in the prior session, one of the first things that I did is I explained the rules of select all that apply, because there are rules that you can consistently use on these types of questions. So just in case you weren't with us for that first session, let me go over those rules one more time. In a select all that apply question, you will see 5 to 6 options, and this is if the question is not in a case study. If the question is inside of a case study, they call that the extended select all that apply, or a multiple select all that apply question. With that one, you could have up to 10 options to choose from. Now guys, it does not matter if it has 5, 6, or 10, or any other number in between those. You're going to treat each option as a standalone true versus false option. That just means look at option number 1 alone and say, is this true to this scenario? If it is, pick it. If it's not, leave it off. When you move on to option number 2, don't think about option number 1 and don't look at any of the other options. You look at each option completely by itself. There are no limitations to the number that can be right. So yes, that means only one of these answers could be right. All of them could be right, or any combination of them could be right. So no limitations. Yes, you do get partial credit, but guys, the partial credit scoring system is not meaning that, oh, I just get something right. As long as I pick one thing right, I can just move on because they're going to at least give me credit for that. That's not true. Depending on a multitude of factors, you could get some part of this question right and still get no credit. So we're going to teach you how to get the question fully right more of the time. The more questions you get fully right, the less you have to take. The more questions you have to take, your test anxiety starts to go up. We already know that. So we want to limit the number of questions that we see. We want to answer the questions and tell the NCLEX people, hey, I'm a safe nurse. You can stop this right now. We're done. All right, you might want to go back and reread the stem of the question with every answer that you pick to, just in case you misread. That's another very helpful tip. Okay, let's go into this question and figure out what's going on, because I can't pick safe and correct answers if I don't even know what the problem is. So in this scenario, they want to know, to reduce the risk of developing a complication following balloon angioplasty, you, the nurse, should implement which measure? Now, strategy. Put yourself in the scenario, in the role as the nurse. And guys, I don't care what role the nurse has. That's you. It could say the charge nurse. That's you. It could say the nursing educator. That is not your teacher. That is you. Okay, you're not the student in the scenario. You are the teacher in the scenario. So you always have to put yourself in whatever the role that nurse is in. It's you. Okay. So in order for me to answer this question appropriately, I first have to know what a balloon angioplasty is, what the purpose of this is, and all the bad things that can happen if they do this. There's no way for me to answer this question if I don't know that. Now, can I guess? Of course, you can always guess. But why would you want to guess when you can know? Remember, the more you guess wrong. The more you know, the more you pick right. So this is the reason why we focus on knowing your content first. Okay, balloon angioplasty. This is a procedure where they use balloons and or stents, and they're going to place them into the client's artery. Now, they can do balloon angioplasty on any artery, but typically when I see angio, I think of heart. Okay, but yes, if they wanted to do this on the, let's say, the renal arteries, they could. Okay, but when I see angio, I do typically think heart. Now, why did they do that? Why do they put balloons and stents there? Well, they're trying to open up that artery, and the reason why I need the artery to be open is perfusion. This is to enhance blood flow. Okay, so this is all about perfusion at the end of the day. All right, well, if they go and they stick stents or balloons into someone's artery, what's some of the worst things that can happen? See, this is where we're going to use a strategy called assume the worst. Don't just think, oh, they might have a little pain. No, assume the worst things possible. Okay, well, they could definitely die. Now, I don't want that to happen, but they could. They could also experience shock from maybe bleeding out, or they could have a lethal arrhythmia. Okay, all of those things are bad. They could throw a clot. Okay, that could end up being very bad too. Okay, do y'all see how we did that? Okay, yes, shock and death. Lethal arrhythmia and death. Throwing a clot, possibly death. Okay, hemorrhaging, death. You see, all of these really bad things, that's what you do. Now, pick answers that prevent that, because this is about preventing complications. Okay, so look at each option, think about all of those bad things, and prevent them. Guys, if you want to prevent a lethal arrhythmia, should you do number one? Do you see how much easier it was to answer that now that you know what's going on? Absolutely, because if I'm not watching your cardiac rhythm, you could have a lethal arrhythmia. And if I'm watching it, I can pick up on that early and try to hurry up and get you out of it. Because I know the longer I let you stay in it, the harder it's going to be for me to get you out. Number one is true. All right, if I'm trying to prevent, let's say, hemorrhage or maybe even a clot, should I assess the puncture site every 8 hours? No, I'm going to miss it. I'm going to miss it. Every 8 hours is too long. Okay, in fact, this client is going to be tired of seeing you. You're going to go in this client's room every 15 minutes for the first hour after this procedure. Every 30 minutes for the next hour after this procedure, and then hourly for the following 4 hours. Guys, they're going to be tired of seeing your face. If I let you get settled in the bed and I say, I'll see you almost at the end of my shift and walk away, oh my goodness, the client is in trouble, right? Hey, option number two, we're going to have complications. False. All right. This makes me think about shock. Number three. So we already said that the client could go into shock. So if I'm worried about that, should I monitor urinary output hourly? Yes, because that is the standard. Measuring urinary output every single hour after a procedure or surgery of any kind is standard. Because what would happen is that if I start to see a problem, the urinary output's going to drop. And if that urinary output drops, I already know this is not good. You're supposed to have consistently good urinary output. Option 3 is true. All right, moving on to option number 4. Okay, well, you just had a surgical procedure. Now, this is important. We did say that they did this on the heart, but how did they get to it? They did not just stab the client directly in their chest. They went in either through the client's arm or in through their leg, the groin. Okay, well, this says affected leg, so that lets me know that they went in through the groin. If I'm worried about my client bleeding or throwing a clot, how should you instruct them to keep that leg? Flat and straight. Do not move it, right? Because if they're in the bed doing leg aerobics and all of their, isometric and assisted passive range of motion exercises, what's going to happen? They're going to bleed or they're going to throw a clot. Be still. So I want you to keep that extremity flat and straight. Okay, well, this says prevent flexion. That just means I need to know my medical terminology. Flat and straight is extension, which is the opposite of flexion. So I want to prevent flexion, which is extension. Option number 4 is a true statement. All right, last one. Sometimes students are like, what does the butt have to do with it? Okay, well, guys, the buttocks has a lot to do with it. Because what did we just say? I want my client to stay flat and straight in the bed. If they're lying in the bed and they keep lifting their butt up off the bed, that is an isometric movement. You're doing the most. I need you to be still. Because what can happen now is you can throw a clot. Option number 5 is true. Avoid lifting your buttocks off the bed. I need you to stay flat and straight. All right. So for this question, your true statements are 1, 3, 4, 5. All of them are true except option number 2. All right. Before we move on to question number 2, let me just remind you, did you see how knowing my content first, then understanding what they're asking in the question, and then using strategy helps me? It keeps me from guessing so much. It helps me know. You want to know more so you can pick more answers correct the first try. All right, let's move on. Look at question number 2, and I'm going to tell you this is another Select All That Apply question. Go ahead and look at this one and let us know in the comments or the chat what you think about this one. All right, if you need more time, you've got it. Okay, but we already know the rules, so let's just apply those again. All of those rules that I told you about Select All That Apply, they work for every last one of them, no matter how many options they are, and no matter if they fall in a case study or not. Okay, so let's see what's going on so we can help this client. They want to know which signs and symptoms would indicate to you, the nurse, okay, remember you put yourself in that scenario, that the client is having an anaphylactic response after receiving penicillin. Okay, I already know that penicillin is a common allergen. A lot of people are allergic to it. And this said an anaphylactic response, which I know is like a major allergic reaction, and it actually is a type of shock. Anaphylactic shock, right? Okay, so when I think of anaphylaxis, I have to remember this is not like they show you on a dramatic television show, okay? Because what happens on a dramatic television show? Somebody eats something with nuts in it, or they get stung by a bee or something like that. And they were perfectly fine at first, and then all of a sudden and they're gone. That is not how that happens in the real world. What happens is that the signs and symptoms start off as something small that you might, brush off. Like, oh, I'm just itching a little bit, okay? And then if we don't stop those signs and symptoms right then and there, they will dramatically increase. Those signs and symptoms have a rapid increase, right? They get very significant really, really fast. And then the client has a dramatic decline, right? Yeah, starts off as something small, rapidly increases in severity, and the client rapidly declines. It is not, I'm perfectly fine, and now, that's not how that works. So what you want to do is be able to show the NCLEX people, I can stop this when it starts. I'm not going to brush off things that I think are not that big of a deal because I know what you did. Some of y'all looked at this and you were like, okay, I'm just picking things that make me think they're about to go right now. No, it starts off as something small that may just look like a regular allergic reaction. And then we quickly realize, no, it's anaphylaxis. Okay? So pick up on the small things early. Do not brush them off. All right, with that in mind, with that great strategy, and I know what this content is, let's look at some of these options. Look at option number 1. The client reports a scratchy throat. Like, my throat's kind of scratchy. What you might do if you are experienced is go, I'll just watch you. That doesn't sound that bad to me. Guys, on the NCLEX, if you don't pick that, they're going to say, oh, you're just going to let them now have a scratchy throat that turns into something more, and then it turns into their airway being blocked off, and then they can't breathe. You have to assume the worst. Isn't a scratchy throat how this could start? Yeah, they could have a scratchy throat or maybe some itching, okay? Or maybe they just don't feel right. They can't express what's going on. Option number 1 is true. Do not brush that off. All right, move on to option number 2. The client has a faint expiratory wheeze on auscultation. Some of you let the NCLEX people use words like faint, drop, scant, small, trace to throw you off, to make you think, oh, that's not that bad. Question, are you supposed to have an expiratory wheeze of any kind? No, because that faint expiratory wheeze, if we don't stop that, is going to quickly turn into a marked expiratory wheeze. And then they won't be wheezing at all because they won't be breathing at all. You've got to assume the worst. Option number 2 is another way that this could start. It is true. That is a symptom that something's going on with the airway, right? Yeah, I'm never going to brush that off. That's not good. Got to pick it. Option 2 is true. All right, move on to option number 3. The client looks at you and says, I feel like something is wrong. Please do not look back at them and go, oh, you do? Really? Well, let me tell you how something wrong is going on in my life. I have worked now 7 nights in a row and they canceled my Walmart order and my kids ate all the snacks. I don't have anything. So when I go home, I got to go to Walmart. Do not do that, okay? When they look at you and they say, I feel like something is wrong, you have to run with it because I have no way to measure that. This is that sense of impending doom. And guys, let me tell you where that comes from. Hypoxia. They're starting to get hypoxic because they didn't really actually realize that they couldn't breathe very well and they weren't getting enough oxygen to their brain. And now their body is starting to scream at them, I don't know what's happening, but something's happening and you better do something. And all they can do is go, I don't feel right. You better run with that every time. That is that sense of impending doom and your client is about to be in big trouble. Option number 3 is true. All right, move on to option number 4. A bounding radial pulse at 100 per minute. All right, let's break this one down. 100 per minute is fast. Okay, and I know what happens in shock. Now, guys, shock of any kind, the body pretty much responds the same way. Blood pressure drops, pulse and respirations go up. Okay, so yes, 100 is up. But let me ask you a question. When you're in shock, again, of any kind, do you have a bounding pulse? Bounding means full. That's fluid volume excess. Bounding means leaping. It jumps up to meet you. It doesn't mean fast. Okay, quick is fast is fast, rapid is fast. Bounding means it leaping. It's coming up to meet you. It's such a full and strong pulse that it just jumps up to you. No, the person in a fluid volume deficit or shock is going to have a thready or weak pulse. So the use of the word bounding is going to make this wrong. I won't see a bounding pulse if you're having anaphylaxis. I'm going to hardly be able to find one. It's going to be weak and thready. So again, you have to know your content and your medical terminology in order for you to answer this the right way. 4 is false. All right, move on to option number 5, our last one. The blood pressure is 100/70. All right, now I know we get caught up in all of that textbook perfect, like vital signs, especially blood pressure. Guys, blood pressure is a range. Please do not look for 120/80 because you're hardly ever going to get that number. Blood pressure is a range, and as long as the blood pressure is within range, it is normal. So if I take somebody's blood pressure and it's 100/70, I'm going to be like, what do you do? Tell me, like, how do you keep the stress away? Like, what do you eat? I need to know all of your secrets because this is what I'm talking about. If all of my clients could come in and I get a 100/70, I'm going to jump for joy. Right? That's a great blood pressure. I love to see that. If you're having an anaphylactic response, are you going to have a happy, perfect blood pressure like this? No. So what do? Where's the cutoff? Here's your strategy and your rule. When the blood pressure is less than 90/60, that's when I'm going to panic. Anything 90/60 or higher is enough pressure for good perfusion. The moment that either of those numbers drop below that parameter, that's not enough. I'm going to panic at that point. So there's your number to panic. 100/70 is not it. That sounds great. All right, so that's false. So for this question, your true statements are just 1, 2, and 3 only. Okay, again, you got to know that content. And there's some other strategies that we need to mention here before we talk about question number 3. Okay, so let's talk about it. This test is not for an experienced nurse. That's why if you had like an experienced nurse who does not understand the way that the NCLEX really works, look at some questions, they're going to pick all wrong answers. They're going to pick answers that go against what you should pick because this test isn't for them. This test is for you. And guys, I'm going to also tell you that in some situations, there aren't really wrong answers. They're trying to see if you're going to pick the thing that you should do because you don't have experience versus picking something else that an experienced nurse would pick. What that lets them know is that they just told you. They just told you and you went with it. You didn't have clinical judgment of your own. You used somebody else's clinical judgment. And when you don't have them, whose clinical judgment are you going to use? Oh, you see? That's why we don't go to work and show these experienced nurses, hey, I'm getting ready to take these NCLEX. I need you to look at these questions. They're not going to tell you the right answer because it's not what they would pick. It's about what you would pick, okay? So you have to think like you're new. That's number 1, okay? Think like you're a brand new nurse. Another thing that you need to do is think NCLEX-y. Okay, what in the world is NCLEX-y thinking? That really involves 3 things. Number 1, assuming the worst. We've already talked about that. Okay, every scenario I get, I just need to assume the worst about it. Number 2, I need to fix the problem. I don't need to just find the problem. I don't need to show things that, show me or show them how much I know. I need to fix whatever issue they've presented me with. And then last but not least, safety, safety, safety. It is the name of the entire test. All right, the whole test is about safety. So you need to keep safety in your mind the entire time that you're taking this test. What's the safest thing I can do? What is the thing I can do that will keep my client the safest? How do I get out of this scenario without losing my license? Right? Safety. All right, now, with that in mind, let's look at our last question. All right, for this one, again, you got to know your content, and it's another select all that apply. So look over this one and then let me know in the chat or the comments what you think. All right, friends, if you need a little bit more time, you've got it. But let's just go ahead and start looking at this one and see if we can figure out what's going on. Select all that apply. I know my rules. I'll just apply those. Okay, so in this scenario, they want to know what should you, the nurse, include in the post-op care of a client following the removal of the posterior pituitary gland. Okay, that means that I not only just have to think about the client being post-op, what did they specifically remove and what does that affect? Okay, so they remove the client's pituitary gland. Okay, so when I think about the pituitary gland, that's right here. Basically, just point between my eyes and I'll find it. Okay, and what that is responsible for is my ADH, anti-diuretic hormone. Okay, so what happens is if they go and they remove that, anti means no, diuretic means void. So this is responsible for making me not void. Okay, so if they go and they remove that, I'm about to just void everywhere. Because now I don't have anti-diuretic hormone. I'm just going to start going everywhere. And if I start going a whole lot and go everywhere, I'm going to go into shock, right? And if I go into shock, I'm going to be in trouble. If I know that content. Guys, that's not how it talks about it in a textbook. You don't have to know it scientifically and how they talk about it in a textbook. You just have to know it like that, like a brand new nurse. They took it out. It was responsible for my anti-diuretic hormone. I'm going to go into diabetes insipidus. I'm going to void everywhere, and I'm going to be in trouble. Shock. See? Okay, so now that we know that little piece of content, let's apply that, and let's pick answers that keep the client safe. All right, look at option number 1. Now, guys, you did not even have to know about the pituitary gland to make sure that you pick option number 1 as true, because you already know after a surgery or a procedure of any kind, I should monitor your I&O. Like, I'm really not doing a good job as a nurse if I don't do this. So option number 1 is true. I didn't even have to know about the urinary output thing in order for that to be right. So 1 is true. Okay, move on. Option 2, restrict fluids to no more than 1,500 milliliters a day. Well, if you didn't know what happened with the pituitary gland, you would guess about this one. You don't have to guess. We know now, don't we? Yeah. We just said that this client's going to go start voiding everywhere because they don't have anti-diuretic hormone, meaning they're going to go into a fluid volume deficit, they could go into shock, and then have death. So are you going to walk up to somebody who's losing all of their fluids and go, I don't know what you were thinking, but give me this water pitcher. Bye. You know you can't have that. That's too much. No. I can't restrict this client's fluids. I need to encourage this client to drink. They're going to be drinking. They're going to get IV fluids. They're going to get all of it. Option number 2 is false. But see, again, if you did not know what was going on with this content, you would just have to guess about that option. All right, move on to option number 3. A daily weight is an excellent indicator of fluid volume status. And this client has been losing a bunch of volume. I want to weigh you to see how much it is or to see what's going on. So option number 3 is an absolutely true answer. But let me give you another strategy about number 3. I know we're not supposed to do this. Okay, we're not supposed to tie the answers together. But there are some things that you just don't ever separate. I&O and daily weight are like the best of friends. If you see one, you see the other. They're always together. Don't separate them. Okay? Don't. If you do I&O, go ahead and do a daily weight because they go together. So option number 3 is true just because we already did the I&O. All right, moving on to option number 4. Monitor urine-specific gravity. Now, if this would have said monitor urinary output, I know you would have picked it because that would have just been straightforward. We know to do that. But it doesn't say that. It says specific gravity. Why would this be important with this scenario? Because what's going to happen is that urine is either concentrated or dilute. And in this situation, the client is going to be voiding lots of dilute urine. If I'm checking their specific gravity, I can see how dilute or at a point how concentrated it starts to get. Because at a point, they're not going to have any more urine to give me. And that's going to be really bad, right? Right. So if this number begins to fluctuate too much, I know that we've got an issue. So option number 4 is true. But you wouldn't know to pick that if you didn't know what this was about. This is the reason why content is king. All right, look at option number 5. Assess their LOC. Absolutely. I'm going to watch your LOC for 2 reasons. Number 1 is because I'm already scared that you're going to go into shock because of your fluid volume. But number 2, this was a head thing. They got to this by going up through your nose into your brain to get to your pituitary. I need to watch your LOC. So if you start having changes in that could let me know that we really have an issue. Option number 5 is true. All right, and then moving on to option number 6. Instruct the client to avoid blowing their nose forcefully. They didn't even have to put forcefully at the end of this. I don't want you to blow your nose at all, because think about it. They did not drill a hole right here. They went in up through your nose. So that means that you have a little suture line in here. If you blow your nose, 2 things can happen. Number 1, disrupt the suture line and bleed. Number 2, increase your intracranial pressure. Oh my goodness. We don't want to increase your intracranial pressure because I'm already afraid that that's going to happen because this was a head thing. Option number 6 is true. Guys, do you see how knowing your content helps you breeze through these questions better? No guessing. I know it. That is why knowing your content first is going to help you so much. So for that question, 1, 3, 4, 5, 6, everything true except option number 2. All right, let's talk about our review options because, guys, at Hurst Review, we have a review option for everyone. And I'm going to really encourage you to go to the Hurst Review website, hurstreview.com, and if you scroll down the home page, you're going to see a little video, and it's got options. It's going to ask you questions, and you're going to pick the answer that feels the best to you. Based on the way that you're answering those questions, Sarah is going to tell you what option of the review you should take. See, this is just to help you pick between the options. And again, we have a review option for absolutely everyone. So let's just quickly discuss the differences between 2 of our most popular options, Hurst Now and InStream. When it comes to Hurst Now is fully online. It is completely self-paced, and it is really good for the student that needs more flexibility in their learning plan. So this is really good because you also choose your length of access. Do you need 30 days, 60, 90, or even 120? You choose how many days that you have based on when you think your test date is going to be or when you know your test date is going to be, and you just choose this and work at it through your own pace. But if you're a little bit more like me and you're like, no, I need some structure. I need a classroom style environment. I need to show up somewhere at a certain time so that way I can stay on track and on task. Then you're going to like InStream. InStream is very much like what we're doing today. I am in the studio right now live at a certain time. You guys are at home or wherever you are right now, logged in live. We are interacting. We can talk back and forth in the chat. You can ask me questions. I would answer those questions. I'm going to ask you questions. You can answer those questions. And guys, the InStream works just like that. The difference here is that it is 3 days of live content, but then we also give you an online account too in your package, so that way you can go back and watch anything you need to again, or if you miss something, you can go and watch it. You will have a 6-month or a 9-month account access for this option based on if you are a PN or a VN student or an RN student. All right, now let's talk a little bit about Elevate. Elevate is the study companion to the Hurst Review product. Now, you can add Elevate to any option, but it automatically comes with our Hurst Now Plus option. That's the one that's fully online, that's 120 days. Elevate is really good because sometimes what happens is that students don't really understand or do really well with the studying independently part. They can watch the video and fill in the blank. That's fine. They can do that on their own. But they're having a little bit of trouble with the study part when they're doing that independently. Well, we made Elevate so they don't have to do it independently. They just join us again with a video and we walk them through everything. You also get additional questions and strategy and scenarios that we put you in to practice. So Elevate just alleviates that, anxiety about studying, and it makes sure that you study the right things in the right way. All right, we love a payment plan. I know you guys do too. And so we've got 3 different servicers that we have partnerships with for payments. So you can either utilize PayPal, Google Pay, or Apple Pay, and it is live. So I really love these options, especially the PayPal option, because with PayPal, you can use or choose to spread out your payments for as much as a whole year if you would like to. So if you want to do the pay in full, that's fine, but you also have PayPal credit as well, and if you want to spread out those payments for a longer period of time, you can. And this just makes it so much more affordable for students because it makes those payments really bite-sized. All right, we want to give you access to our free events, so make sure that you join us in the future for any free events that you would like. You can either just visit the website and it'll take you to the free events at the top, or you can scan this QR code, bookmark the website that comes up, so that way you can register for any free events that you would like to in the future. And guys, the reason why registering for the events is so important is two things. One, this gives us a way to contact you. We send you things like discounts and information about changes at the NCLEX and things like that, so you stay in the loop. But then two, it also enters you automatically when you join us for our sessions to win a free QBank. You have to be a registered viewer to be able to have access to win that free QBank. All right, let's get you the discount code for the last time today. Okay, so this is free 2025. It's good all year, so it does not expire until the end of the year. It'll take up to $40 off of your review of choice. And we do not give this code out anywhere else except in these free events and when we do our live events on social media. We do not post the code. We do not send the code via DM. We do not send the code over email. So you will not get this code, specifically this one, anywhere else except here. So make sure that you take a picture, write it down, screenshot, whatever you need to do. All right, guys, we do not have an eligible winner for our QBank for this session. Okay, let me just remind you how you are eligible. First, you have to register for the event before you come. Make sure you're in the event the whole time from start to finish. You can't have already won the QBank, so if you're a previous winner, can't win it again. And then also, you have to make sure that when you register, you give us your full details. We have to have your full name to be able to match you to that name in the registration. So just make sure that you guys are doing that if you want to have a shot at winning the QBank. We had a winner at our first session, but we do not have a winner in this session. But guys, don't worry, come back. We're going to have more sessions. Make sure that you check those out on the free events website. Register for those and you will have a shot at winning a QBank as long as we have registered winners. All right, guys, that is all I've got for you today. I hope that you stay safe, continue to save lives. Best of luck to all of you on the NCLEX. Join us again in the future for more free events. Take a Hurst review. Go and take that journey to find out which option of the review works best for you. And follow us on social media. We are at Hurst Review or at Hurst Review Services on all of the platforms. Guys, have a great rest of your day. Bye-bye.